The experimental COVID-19 vaccine is now available, and you may have questions about the safety and effectiveness of this new product. Good for you. It's your body, your health, and you should have questions. Don't blindly follow the pack just because you're told to do so. Today, we will be discussing what facts you need to know to make an informed decision about whether you should be getting the experimental COVID-19 vaccine. Good morning, health-minded people. I'm Dr. Snow, and I teach you to be in charge of your own health because other than God, no one knows as much about you as you do. Recently, I've had friends, family, and patients asking whether or not they should get the experimental COVID-19 vaccine. And I say experimental because it has been given emergency use authorization but has not been approved by the FDA because all criteria have not yet been met for full FDA approval. Other questions I'm getting is it safe? Does it work? Is it necessary? And what are my alternatives? These are excellent questions, and I believe that you need to know the answers. First, is it safe? Maybe. The initial studies are very promising, with few serious side effects being reported on the CDC website. There has been one report of a physician who died from a brain bleed 16 days after receiving the vaccine, but at this time, while it's being investigated, it hasn't been determined if it was due to the experimental vaccine. And there have been other reports on the internet of serious reactions, but nothing has been positively attributed to the experimental vaccine. The first investigational dose of the experimental COVID-19 vaccine was given on March 16th of 2020, so we have 10 months of information on the safety of this product. And the first dose was given to the general public on December the 8th, 2020, so that's been just over a month now. Of course, before a new pharmaceutical hits the general public, it will usually undergo about 10 years of testing to ensure that it is safe and effective. So 10 months might have been a bit quick, but this is something that you are going to have to decide for yourself before you choose whether or not to get the experimental vaccine. Also, many medications that did undergo years of investigation before they were approved by the FDA were removed after a time because they were found to have serious and sometimes nasty side effects that didn't show up in the clinical trials. But assuming it is safe, is it effective, and how long will the protection last? Initial studies show that those vaccinated are at least 90% protected against getting COVID-19 after the few weeks that it takes for your body to build up enough antibodies to protect you. During this time, it is still possible for you to get the virus. And as of January 2021, we do not know how long you will be protected against COVID-19 because we haven't had the time to do the studies. Just as we haven't had the time to do the studies on the long-term side effects of the experimental vaccine. So pretty much we don't know how long the vaccine will keep you protected. It is possible that you will have to be revaccinated every year like with the flu, or even every few months. If I get the experimental vaccine, will it prevent my loved ones from getting COVID-19 if I do get the disease? At this time, it is unknown if the experimental vaccine prevents the spread from a vaccinated person to another person. If this information is helpful, please hit that like button and consider subscribing to my channel. Is getting the experimental vaccine necessary? Well, that depends. Are you over the age of 70? Do you have a chronic disease such as high blood pressure, diabetes, COPD, or cancer? Do you live in an area that has a high rate of COVID-19 infection? Have you already had COVID-19? Per the CDC website on January the 16th, 2021, the mortality rate of a healthy adult under the age of 70 in the United States is 1.6%, which means that 98.4% of those who get COVID-19 will recover. Older adults are more likely to suffer the serious effects of COVID-19 than younger, healthier people, and people with chronic illness are also at increased risk. If you fall into one of these categories, you may want to consider getting the experimental vaccine. If you live in an area that has a high rate of COVID-19, which is usually the larger cities where more people come into contact with each other, and you fall into a high-risk category, you may want to consider getting the experimental vaccine. If you've already had COVID-19, the CDC is recommending vaccination anyway if it's been more than 90 days since your infection. But why? If having the virus doesn't protect you from contracting it again, why would the experimental vaccine give you long-term immunity? So are you going to have to be revaccinated every 90 days? The National Institutes of Health in Great Britain has published an article stating that healthcare workers who have had COVID-19 were protected from reinfection for many months. So if you've had COVID-19, you may want to wait to get the vaccine until we've had more time to discover how long you are actually protected. Will the current experimental vaccines that are available cover the mutations that are beginning to emerge? We don't know yet, although preliminary data is giving us a good solid maybe. Again, we haven't had the time to study whether or not they will cover any mutations that occur. And it depends on where the mutation occurs within the virus. So once again, we will have to wait and see. So, who should not get the experimental COVID-19 vaccine? If you are allergic to any of the components of the experimental vaccine, you should not take it. The most likely ingredient that you may have an allergy to would be polyethylene glycol, or PEG, which is found in some medications, including the laxative Miralax. And because of cross-sensitivity to PEG, if you are allergic to polysorbate, you should probably not get the experimental COVID-19 vaccine. If you've ever had a severe, especially an anaphylactic reaction to any vaccine, you may want to avoid the experimental COVID-19 vaccine. If you've had an allergic reaction to the first dose of the experimental COVID-19 vaccine, you may not want to get the second dose. If any of these situations apply to you, but you would like to get the experimental vaccine, you should discuss the risk with your personal physician. So what can you do to prevent being infected with COVID-19 if you decide to not take the experimental vaccine? To prevent any infection, including COVID-19, a cold, or the flu, you must take care of your immune system so that it can take care of you. Eat right, stay away from junk foods, stay away from sugar, which can weaken your immune system. Eat lots of fruits and vegetables, especially raw fruits and vegetables, and eat lots of leafy greens. Have a salad once or twice a day. Drink plenty of clean water. Aim for about 10 cups each day, and more is even better. Get at least 7 to 8 hours of sleep each night. Did you know that your body heals itself when it is in the deep non-REM cycle? If you are not getting enough adequate quality sleep each night, your immune system is weakened, and moderate exercise, such as walking 15 to 30 minutes every day, can strengthen your immune system. What questions do you have about the experimental COVID-19 vaccine? Leave your questions in the comments below. COVID-19 usually causes mild or even no symptoms in people under the age of 50 who are in good health. Those with chronic health issues are at greater risk of the more severe effects of the disease, including death, but this is a very odd disease. My own 87-year-old mother had a very slight fever, felt ill, and slept for about 48 hours, and then she was fine. My friend, who was 56 years old and in apparently good health, died in less than a week. I am not going to try to talk anyone into or out of taking the experimental vaccine. Because we have so little evidence of the long-term safety and efficacy of this product, I am telling those who ask to weigh the pros and cons. Ask your personal doctor what their recommendation is, and then ask them for the answers to these questions we've just gone over. Then, make a decision on what you believe is best for you. If you are more comfortable getting the experimental vaccine and believe the possible benefits outweigh the possible risks, get the experimental vaccine. If you are not comfortable taking this experimental vaccine until we have more information on the long-term effects, don't get it yet. Wait. But if you don't get the experimental vaccine, you must be willing to continue social distancing to keep from getting or giving this disease. If you have any symptoms, stay home to prevent spreading the disease. So which choice will help you sleep better at night? Everyone is an individual and must decide for themselves what their best decision is. If you have found this information helpful, but want more information on how to support your immune system, click and watch this video now. Thank you for joining me today to learn how to decide if the experimental COVID-19 vaccination is the best choice for you. Stay healthy, make an informed decision, and have a blessed week.